All right, there we go. So this is the first lecture in a series of lectures by the Community Outreach Committee, essentially titled Journey to the US. We will be talking about, sorry, we're getting a lot of chat messages here. Okay, thank you very much. We will be talking about all the various pathways. Some of them are well-known, some of them are not well-known, and that's kind of the whole reason why we're doing this. The first talk that we're doing today will be about the direct pathway, people who have done research beforehand, and people who have transferred halfway through their residency. Further topics, we'll talk about people who want to come here just for fellowships, people who will do credit exemption process, and then we'll have a bunch of subs along the way. So without taking up too much more time, let's go ahead and get started. And we're just kind of going to run through this very laissez-blanche. Please do save your questions until the very end. And when you do have a question at the end, when we open up for Q&A, please feel free to type them inside the chat box rather than speaking over other people. So without further ado, we'll start with Raneem. Would you like to get started?
Yeah. Hi, everyone. Thanks, Rasul, for planning and kind of organizing this session. We hope to make it, very friendly, ask all the questions you want to ask. This is us trying to, give you as much knowledge as we can. Many of us, when we were kind of like in med school, didn't have a lot of people to tell us how to get here. And this is just kind of us kind of raising awareness for people to come and do surgery in the US. It's a great field. So I'm Jordanian Saad. I'm currently a rising chief resident at Hopkins. I went to med school, JAPA Academy. It's the best. No offense, technos. Just kidding.
We're not going down that path.
Shameless plug, I had to. Then after that, I stayed بعمان. I did سنة امتياز بالمركز العربي. Then I worked بمستشفى فرح. It had just opened for 2 years as a GP. During that time, I kind of used it to do my USMLEs, to do a little bit of research projects on the side, kind of email people, make some connections, and then I applied to the match. A lot of my colleagues will talk about, how to come to the US, and there's many pathways, but if you're going to start residency from scratch, you can either start as a categorical, which is, you sign a contract with the program, you're going to graduate from there, which is not common for internationals. It's not impossible, but not common. The more common pathway, and you'll see a lot of international graduates doing that, is to do a year or two of prelim years. And that's basically doing 1 year at a hospital. You get a 1-year contract, 1-year visa saying, we'll take you for a year, and then you have to go elsewhere. Now, in my situation, I came to Hopkins, and then after that 1 year, they said, you can go through the match and go elsewhere, but we would like to keep you as a 2nd-year prelim. So I said, okay, I'll stay as a 2nd-year prelim. Still also not guaranteed. So then after 2nd-year prelim, you also have to apply to other jobs to get a categorical. Few hospitals sometimes have openings, and mine did, and they ended up choosing me to stay as a categorical. So now, fast forward, I'm, 1 more year to go, and then I'll be done. What other questions do I have to answer? So,
no, I mean that's great. So, you essentially did about 2 years in Jordan, where you took that time to kind of build up your CV, did some research, and then you applied, as you mentioned, through the match.
Yeah.
Do you feel there was any one particular part that you prepped or had done that really strengthened your application, or got you that opportunity at Hopkins, which is one of the top hospitals, if not the top at this point?
Yeah. I think first time around applying to the match, the most important thing on my CV was just one, no red flags, which is no low scores or passing, first time or whatever. And one of the important things is my letters of recommendation from my elective. I was fortunate enough, my school had affiliations with multiple hospitals in the US. So I came as a medical student to Vanderbilt, did a gynonc rotation, and then went to Case Western with Hajiri and did an EP cardiology rotation. They were both non-surgery. So I get this question a lot. Do I have to do a surgery rotation? I think it's preferable. But none of my electives, none of my letter writers were surgeons. But my letters were awesome. And, I give them the thanks, forever, for like kind of showing people, because these people they're interviewing me, they don't know who you are. They've never met you. They don't know any other surgeons who've written about you or know anyone who is saying anything they know about you. So I think my letters and just having a normal CV was kind of got me the prelim spot.
Can I ask a question?
Sure, Dr. Morar.
So did Hopkins, so you didn't apply to the match again when you were a PGY1 prelim?
I did, and I interviewed, and then I didn't rank.
Okay, so then they offered you the PGY2 prelim.
They had offered me from the beginning, but then when I interviewed, I got some programs, and actually at least 2 programs told me they'll rank me to match, but I didn't like those programs, and I was stubborn enough to stay as a prelim. I don't recommend it.
Yeah. Oh, so you interviewed and you didn't even rank?
I didn't rank.
Okay, I got you.
Yeah.
And we can talk more about the prelim 1, prelim 2 kind of jumping pathway when we open this up to group, because I do know, I believe at least maybe 4 of the 6 on the panel today kind of had to do that prelim 1, prelim 2 kind of path, which is kind of what happens when you take this route. Yeah. But yeah, I think that's fair. I'm kind of trying my best to keep time here. Any last things you'd like to say, Renee, before we jump forward?
I think just don't give up. When I interviewed when it was in person, and I remember coming to Baltimore for a whole weekend and taking pictures with the Hopkins, the dome, the bridge, everything Hopkins, and been thinking to myself, this is the first and last time that I'll ever see this hospital. And here I am almost 5 years later. So just you never know. You never know.
Yeah. And I know I'm not talking about myself today, but I definitely second that. You never know. When I made my move to the US, my first response was, these people will never, ever accept me. They won't take me seriously. And my wife actually said something. She said, you miss 100% of the chances you don't take.
Yeah.
I sent one email and that was it. So you really never know. All right. Moving forward, Dr. Marar, Omar.
Hello, everybody. I'm Dr. Marar. I'm in Michigan. I'll briefly go through my story. I finished high school in Jordan, and then I actually went to the US for undergrad. When I was in the US for pre-med, everybody was telling me, you're not going to get into med school. Forget about it. Because I was on a visa and I got scared. So I applied through a program called Atlantic Bridge, which accepts US undergrads into UK medical schools. So I ended up transferring to medical school in Ireland. When I was in Ireland, I knew that I wanted to go to the US. So I did a couple of US electives. Again, I was fortunate that my school had affiliations with Indiana University, and I was able to go do an elective there. And then the other elective was in Rhode Island. I found that by myself. I paid some money and they took me for a month. That was for colorectal. So during medical school, I was able to get a couple of letters of recommendations through those electives. I did my USMLEs and I applied straight to the match. And I matched as a PGY1 prelim. I'm a Jordanian citizen, so I had to go on a J1 visa. I'm sure we'll talk about that later, Rasul, right? That's kind of a different thing, the immigration.
Yeah, we're actually doing a complete lecture on immigration, and we're looking for a lawyer that we're planning to bring on.
So we'll just leave that to the side.
Yep.
So I matched as a PGY1 prelim, and I applied through the match again. I ranked, and I didn't match the second time. So I applied outside the match. There's a website called APDS. You'll become very familiar with this website if you're going to be applying in the US, because like was mentioned before, it's very rare to just go straight into categorical. It's not unheard of, but it's very rare. So then I ended up finding a PGY2 prelim at a different hospital. So again, same story. I went to that other hospital, again, PGY2 prelim. I couldn't apply through the match because you're not allowed to go from a PGY2 to a PGY1 if you're on a visa. So I just waited and kept applying, didn't get anything. And then towards the end of the year, the program I was at offered me the categorical position. So I was just able to finish residency and go right through. So it's kind of the same story, except I did it, my PGY1 prelim and my PGY2 prelim, I did them in different programs. And I had to find the PGY2 prelim on my own. And I did it through that website, the APDS.
Omar, let me ask you, you went to RCSI, is that right?
Right.
Do you feel that helped you out in any significant way, like when they were reviewing their applications, or it opened the door for you?
I think so. When I was interviewing, they asked me a lot of questions about it, and it was a point of conversation. Mm-hmm. Yeah, I think it did help me that it was a UK medical school. It has surgeons in the name, you know, probably subconsciously, something like that.
Just a little bit. And did you, another big point was, did you have any previous research experience?
No, not really, actually. The medical school makes us publish one paper in the student journal. It's technically peer reviewed. It's a student journal. It's printed. But we actually spent like a couple of months collecting data and doing real research, like lab draws and getting B12 levels. And it was a study to see B12 levels in patients who use metformin. So that was really the only one paper I had. That's it.
Okay, fair enough. And then you essentially, after residency, moved on to fellowship. And
and then the rest will be discussed in immigration because it will be relevant there.
Yeah, you have quite the immigration. Yes. Yeah, we're talking about that. All right, any last thoughts before we move on? We're doing well on time. All right, Dr. Slih.
يعطيكم العافية جميعا الطلاب والزملاء وشكرا على الاستضافة اليوم. هلا أنا الباثوي تبعي كان I got lucky I matched into categorical I went to the research pathway. أنا اسمي محمد صبيح خلصت في الجامعة الأردنية وعملت سنة امتياز. وبعدين I went to Boston. I worked with a cardiologist, Dr. Mike Gibson, on Wikidoc. That's a non-peer-reviewed online medical encyclopedia. Dr. Gibson, he was a very successful cardiologist at Harvard. So I worked there for a couple of months immediately after the MTS. I felt I want to get more research work in surgery and more connection with surgeons because I was applying for surgery, and Dr. Gibson knew that. So I started emailing leaders at Harvard who are surgeons, and I got very lucky. One of their emails was I sent almost 50 emails, and one email came back, come for a grand round, and we will meet after for a volunteer spot. So I went there at MGH, met Dr. Pat Sella. She's now the president of SAGES. She was not president of SAGES at that time, but I met with her, and she said, why you want to do that? I told her I'm very interested in research and very interested in surgery. It was a brief meeting, 10, 15 minutes. She felt maybe I'm interested and look forward to do hard work and publish during the year. So she took me. She somehow made arrangement with Dr. Gibson and the other lab, the Wikidoc group. So it worked. So I started working with MGH, at MGH with the group. It's the notes group. And spent a year there. It was a great year. It added a lot, and it helped me match into surgery. So I matched into categorical, one of 3 spots at Harlem Hospital with Columbia University in Upper Manhattan. And during that year, I also continued working on Wikidoc, online editing surgery pages mostly. So I kind of did both work during that year. And during the interview, it was clear that I had the upper hand in the interview doing research in surgery in the US at that time. So I'm mentioning this because the students thinks maybe the research here may be a loss of time, or it be maybe a gambling. It is not. So if you focus, if you work hard, and if you believe, you're gonna do it. And most people succeeded. Most of the people who went to do surgery in the US, I knew they stayed. Very few, they were unlucky and went back. So I completed the residency and did currently I'm in practice. This is my 6th year in general surgery practice. I work with UPMC now, and I plan to move on to do an extra fellowship year. I got my green card this last summer. I plan to do one extra year of fellowship, bariatric and MIS with robotic surgery.
Yeah, I mean, I think you touched on an important part, which is the research experience. We saw previously some people did match without research experience, and then we see in your pathway that the dedicated time and research, really helped you out. And in your case, you even were able to match directly into categorical, which is in of itself, very hard to obtain. Do you think it was purely the research that helped that, or do you think it was also, probably you presenting yourself well, making the right connections with the right people, and kind of just overall a 360 very well balanced resume?
I think both, Rasul. I think both, but research is critical. I wouldn't have matched into a categorical spot 1 in 3 if I wasn't doing research and published. There's no way, because they interviewed more than 100 applicants for 3 spots. Why would they have ranked me if I didn't have a research experience?
Exactly.
So I think both. They also want to make sure you are a person they can work with, and you are a person who you can learn. This is what they're looking for. And at the end of the day, they want people, they want residents. Every program looking for a residence. They can't run the work without us. So they just want to find the right person for the right spot.
Exactly. And I couldn't stress that hard enough. A lot of people come in thinking it's what their paper looks like, what their CV looks like. In reality, every program, the way they think about it is they want someone who will make their life easier in the long run. Someone who is teachable, someone who is reliable, and someone who's very trustworthy, right? Because they want to be able to know that if it's 2 a.m. and you're seeing a consult as a chief, that they can take your judgment and your words. So it's kind of that whole 360 approach. Yeah. Any last additions to that?
No, thank you. And we'll leave the mic to the colleagues.
Yeah. I think next we have Dr. Aouni Shahel.
Again, for arranging this. I know it's a lot of work to get this together, and I'm really impressed by the number of people attending. So that's really good. That's a really good sign, like, of people being involved. I want to hop on this difficult road, but it's doable. So I graduated from JAMA Jordanian, same thing, 2011. I did my internship at JAMA Jordanian because I was like, okay, I want to get more involved be more in the academic field, and also was into research. So I started my research journey early on, like when I was a 4th year in JAMA Jordanian. And I think by the time I finished and left Jordan, I was had almost 12 to 14 publications at that time. So even with limited resources, I was pushing the limits, working with people, helping projects, making connections, and leaving good impression. And that's whenever they hear you do research, then everyone will ask you, can you come and help us with doing this? So after I finished my internship, I was thinking about going out, but I had some family situation. So even I matched the AUB, Beirut, but I ended up deciding to stay in Jordan. So I ended up matching as a general surgery resident in JAMA Jordanian, and I stayed there for 3 years. I think it was a great experience, to be honest, with the environment that you work and the mentality you deal with. And then when you decide to do the transition, you see how big is the difference. Of course, my teachers and the surgeons at JAMA Jordanian, they had a great impression on me, but also that can also trigger me that, okay, what can I do different? And as Rasul said, if you don't try, this is 100% you regret this. So I was at a point, okay, I'm a 3rd year in residency. I have 2 years more and I will be done with the training in Jordan, this is the right time to leave for now. So I decided, no, I want to try something. I want to knock the door. I have my certificates and my scores. I have research, so I may have a good chance to match. So I applied that year. This is like, a number to let people know is nothing is impossible. So I remember that year I applied for 120 applications. And it's a lot of money, talking about 3,000 to 4,000 at that time, and plus traveling because it was before COVID in 2015. So I applied, and just only one program sent me an interview, which is Wayne State University in Detroit, Michigan. So I came, it was, I remember January, I sat for 2 weeks trying to get hold of other programs, like, okay, can you send me an interview? I did not hear anything from you, but it was dead silent. So I just did one interview at Wayne State. I left and I was like, okay, it's a 50-50 chance. Like, I may not match. And okay, I tried, did everything, and I may match. So luckily enough, I ended up matching as a prelim one in Wayne State. And I think factors what helped me, I think being a surgeon resident, that may help having publications. Also, that's helped. Also, I did a U.S. experience when I was in sixth year in Jordan. I came to George Washington University. I did almost 2 months and a half of surgery, endocrine, like trauma surgery, endocrine, and breast. So it was really great. I got a great recommendation letter. As Raneem said, it's not like, who's writing you the recommendation letter. I think working hard to impress people, they're like showing up early. I remember showing up at 4 a.m., round, finish notes, go to the door, and I don't leave till 8 a.m. And the recommendation letters I got, they were amazing, alhamdulillah. And even after many years, I got them, and they I think made some difference. So I came here, I came to Wayne State as BGY1. I applied to the match, worked hard that year. I scored the highest in the in-service exam on my group, so I got 99 percentile. And I was like, I also got the Intern of the Year award. So I was like, trying to impress everyone and keep everyone happy, which is, I think, also comes to another thing. Despite that, I have a surgical training, which is hard. A lot of people think, okay, this guy was coming in with already, he has some knowledge and how easy to work with him and how easy to change these things. And which is I did, I looked everything behind, and okay, I want to learn from you. This is because I'm here, I want to learn everything. I want to learn it the right way. And I think that went well. I had a good connection with my colleagues, my attendings, and everyone. So I applied for another time the match that year. I got a couple, I think 3 or 4 interviews. I think he helped me. I came to Harlem for an interview, but unfortunately I did not match that year. And my program, my old PD, Dr. Tyberski, he told me after that, like, okay, I want to offer you a BGY2 prelim. So I was like, okay, I don't have any other options. So I took it, and I just want to go through this. At the meanwhile, this what can also go in the background, that whenever was a residence in Amman, I asked him to drop 1 year in case if the thing does not work. I have a spot saved with JAPA Academy, so I come back and finish my training. And that was like time that, okay, I just want to let go of that. And the 3 years I did in Jordan, they will go as nothing. Or I just want to continue, go back to Jordan. So I ended up staying because I felt that I have a good chance to stay based on feedback and everything. I did BGY2 prelim, applied 3rd time to their match, and I matched as categorical in Wayne State, but I ended up doing BGY2 categorical again. So I did prelim 1, prelim 2, then BGY2 categorical, then finish my training in Wayne State. And I did the surgical critical care, same thing in Wayne State. I ended up saying because of my wife, she was doing a PhD in Wayne State, so I stayed that year. And then this is my first year into practice. I'm happy with my experience, and it's like a great journey so far.
Yeah, thank you, Auni. I didn't make this clear before. We're transitioning onto a new group of pathway candidates. So starting with Auni, and for the next 2 to follow, these are individuals who essentially transitioned to the US after completing a number of years of surgical training overseas. And that's to also see, what benefits that adds, what, detractants there might be, But I think I only kind of touched on something very important, is that even though you do show up with your training, you have to make it very clear that I am a blank slate. I am here. I am teachable. And he mentioned some of the additional factors in addition to the prelim dance, as we kind of call it, which is you have ways to shine, including the app site. And we can talk about the app site a little bit further down. But I do want to ask this, Ani, do you feel the fact that you kind of showed up with some form of surgical training, that it's either augmented you learning while you were there, or it augmented your kind of ability to leave a good impression?
I think the latter, which is leaving a good impression, as you said, being teachable and be reliable. I think that make a big difference for me. So that's helped me through my first year. That among my colleagues, I had other kind of IMGs, so my program is huge. They accepted 20 residents, interns. So we take 10 categorical and 10 the prelim. And not all the prelim, they are designated. So half of them they are designated. So I was competing with other kind of 4 prelim IMGs who want to stay for surgery. So it's hard competition to try to show up between this. So I think having good impression, being reliable, being clear, and even not being arrogant, okay, I know how to do this. No, I don't know anything. Teach me. Even central line, teach me how to do it. And I think that went a long way. I think even I finished my training, that has left a great impression in that. So yeah, I agree with you. That's will be my thought about it.
Yeah. Just for a funny story, talk about being teachable. Like, I don't know anything. My pathway was I bounced into a program as a chief resident directly, and as a 5th year, we would rotate on this hospital on the outskirts, and there just so happened to be that rotation, myself as a PGY5 chief, and an intern who was from Iran. So we both had Arabic names. We looked a little bit Arabic. Show up with the attending first day, it's Monday morning, 6:30 a.m. We're about to scrub a case. And I say, can I join you? He's like, yes, of course. I forgot to introduce myself. So he thought I was the intern. So he looks, and we're doing some hernia, and he's like, all right, this is this kind of suture. This is how you close the skin. And he proceeds to take me meticulously through a simple interrupted suture. Not once did I look at him and say, I already know how to do this. I just nodded my head. I was like, why, thank you very much. I will learn from you. After he unscrubbed, he realized who I was, and he apologized. And, it made for a good joke. But you never show up saying, this is who I am, this is what I do, and blah, blah, blah. And yeah, so that's a very good point. I got 2 stories.
Awesome story. I think this is a big reason why some people from the Middle East don't succeed, is kind of have like that kind of ego. In residency, there's no ego.
100%, absolutely
the exact model thing that people are supposed to do.
Yeah. Just
put your head down, keep working.
Mm-hmm. It's a marathon, it's not a sprint. And you need to take it and keep on trucking along. Because there was no reason for me to die on that hill and be like, you don't know who I am. I did not do a hernia. The rest of the day I did 5 other cases, one of which was a Whipple. So it was perfectly fine. We're not here to split hairs. But yeah, moving on. Ahmed Abu Amr, Dr. Ahmed.
Assalamu alaikum, everyone. I'm happy to be here, and thank you, Rasul, for making this possible. I mean, finally, you got to say my name right after working with you and for long and knowing you for how many years?
Almost 10.
It's 10. Okay. Arabic is not your first language. I forgive you. So I kind of will be able to touch base in 2 things: the mid-residency transfer and the prelim path, applying all over again. Because I went through both. First of all, I'm Palestinian from Gaza, went to high school there. Then I, probably different from all of you, went to medical school in Egypt, in Alexandria University. Then I was lucky enough to do my residency training at Hamad Hospital. I went there, stayed for 4 years. What helped me a lot was it was an ACGME place. We took the upside every year, which will I know everybody highlighted the importance of the upside, and it plays a major role if you come from a place that takes the upside in your application.
Sorry, I'm going to interrupt you just one quick moment.
Yeah.
Just for a lot of the people here, most of them are medical students. So to highlight, the AppSite is the American Board of Surgery in Training exam. So it's essentially an exam all surgical residents take. It's in February, I believe, February, March of each year. And it essentially ranks you. It ranks you amongst all other people all over the world that are taking this exam. And then they tell you, you are, the 30th percentile, you are the 80th percentile. And the way the exam works is it's not a real percentile in that you could have 70% of the questions correct and be 30th percentile. But if you have 74%, you could be 99th, depending on where you are and which year of training you are. But programs very heavily look at this in terms of recruitment. So it's highly advisable to do it and do it very well. I know when I was at Harvard and we were recruiting even MIS bariatric fellows, Dan Jones would look at me and tell me, but did you see his AppSite score? And that would be his determining factor. So this is a yearly test that has a very heavy weight to it. Sorry, continue, Ahmed.
Okay. So long story short, in my third year or fourth year, I applied through a couple open positions. Dr. Marar mentioned APDS. Some of those will pop up, and I got interviewed for a third year or fourth year, and I got accepted to a couple, but for some unfortunate reason with my old program due to special circumstances, they did not agree in signing off on my rotation to complete the process after I signed the contract with the hospital here. So that's in the past. So I moved on and I decided, okay, that's my breaking point. I need to move on. So I dropped out and I applied through the match process, which kind of, I can tell that like a common denominator for all of us is a connection that you have made somehow. Going through those interviews, I knew a bunch of people, and it's funny enough, not what many people would advise you to apply to a few places, but I only applied probably to 5 places because I knew those people. I knew I'm going to have interviews at those places and have some kind of relationship with them. So I interviewed with those 4 or 5 places. I matched into one of them as a prelim, which brings us back, even though it's not always guaranteed. So I had to make that big decision of moving, taking my wife and son, and starting all over with no guarantee. Which, I mean, nothing is impossible. Don't let anyone tell you that, oh, you can't do it. You will do it as long as you determine that you have a plan and you have a plan of action to get to your goal. And so I did that year. Yeah, go ahead.
Sorry, go on. So you did your first prelim year, and then for the second year?
Yeah, so I did at Texas Tech my first prelim year. Then I had to go through the match again. In between, I had some kind of relationship with my program director. He would call people for me and get me interviews here and there because he knew I worked with him. He knew I have a background, and I can't stress enough on the fact that you being humble, even though if you know everything, you know a lot. If they should, people respect that in you. If you come with a big head, you're ready. Why are you here then? You're here to learn, even if you know stuff. So he wanted me to advance. He didn't want me to go through all the whole match process again. So he was the reason I got a couple interviews here and there for a third year and a fifth year. Second year, categorical. And I matched. It was outside the match. I had to drop out because I signed a contract for a second year categorical here at Tampa.
All right.
Then I moved in here. I'm finishing my second year, going to my third year.
Nice.
So this is like a quick run of what was the story.
No, thank you. And we are going to move forward just because of time, but we are actually going to come back and kind of touch up on the APDS and that kind of lateral shift, if you will. And finally, we have Dr. Mustafa Hajjar.
Assalamu alaikum. My name is Mustafa Hajjar. I graduated from Hashemite University 2015, did internship in Jordan. During my internship, I applied to AUB and Hamad. I got accepted in both, but my visa got delayed in Hamad, so I had to start in AUB. It was a good experience for 4 months. And then I transitioned to Hamad and finished an entire surgical training for 5 years. I did not apply for the match during my first 4 years because I was in a good program. I was learning, and I didn't want to take the risk of prelim. I wanted always a backup plan. So I wanted to finish my training. So I had the Arab board as a backup plan in case I go and did not match after the prelim. During these 5 years, I had 2 publications. And then during my chief year, I applied for like 130, 135 programs. Every single program that sponsors J visa, I got 2 interviews. I matched in one of them, Brookdale Hospital, as a prelim. It's very hard transition after becoming like a fully trained surgeon. The biggest challenge is to unlearn, as everyone mentioned. So you have to keep this in mind in case you're doing a transition rather than a direct pathway. Also, the USMLE scores, I would say we were fortunate that at my time we had 3 exams. Now we have only 1 exam, but the score will be always imperative. This is something that Jordanian graduate will always be better at compared to American grads. So keep this in mind. And
I have a quick question. Sorry
yeah.
to interrupt. I actually have a quick question for you, Mustafa. Did you do any like US clinical experience?
Oh, no, I did not have any clinical experience, and I would highly recommend for you to do, but kind of my training compensated for my clinical experience.
Oh, no, of course. The only reason I'm asking is something that I've kind of seen, and I don't know if you want to elaborate to this, but for example, without the kind of connections that were possible to be made, you had to apply to more programs for a kind of tighter catch, while some people who had some connections could apply to, as we've heard, 3-4 places, and they kind of already knew how things were going to line up. Would you say that's kind of a correct assessment?
Yeah, the connection is imperative here in the United States, but I would say without connection, you can match. Yes. There is nothing that you can say you need this 100%. We hear 6 people, everyone has a very different experience than the other. The only common thing between everyone is the persistence and the dedication. And then during my first year, I interviewed at 4 programs, didn't match despite getting a 99 in the app site, then had to go to the PGY2 prelim pathway. I stayed in Brooklyn, but I went to different hospitals, Maimonides. During my PGY2 prelim, I applied. We could not apply for the match. I always applied for the APDS open positions. There is no single program sent me an invitation for an interview, except one program where I sent an invitation and I matched. So it's always, nothing is impossible. You have to keep your head down and stay working hard till the end. Then I'm starting my 3rd year shortly.
Congratulations. All right, so that was kind of everyone's pathway. I'm going to kind of highlight some of the main things that I felt. And I'll open up to the 6 of you to kind of jump in at any point and chime in. But we've kind of seen that in order to come to the US, first and foremost, never give up. Never don't take the shot, always do take the shot. We've seen 6 different stories all about people essentially not giving up, not taking no for an answer, making the tough choice, taking the risk. And we've seen how every person kind of had a different portion of their resume, kind of highlighted something that really pushed them. But again, there is no one main factor. So a lot of people ask like, oh, I have this research, I have this core, what's my chance? It doesn't really work that way. You build up your CV to the best of your ability. We've seen people with one research project, And then people with dedicated research time, both matching. Folks who have been taking the app psych beforehand and folks who had taken the app psych with a score of 99. And we've seen it both play into their favor and have no impact. We've seen connections come into effect. And I think what that really tells us is kind of going chronologically, what you guys can prepare as medical students would be US clinical experience, right? When you're in med school, go to the US. Whatever it costs, it will make up for its value tenfold down the line. Come here, leave a good impression. This isn't the time for you to show up. And unfortunately, I've heard this so many times. Just take it easy. It's a vacation. No, it's not. You want to show up and you want to turn up. You want to put your best foot forward so that you get that letter of recommendation. Because I'll tell you this, it's not just what the letter says. A lot of times I'll write a letter to someone and then I'll get a phone call and they'll say, well, this resident, how were they? And if I say, I really don't remember, what does it say on paper? That tells the story. And if I say, oh no, I remember this person, they were a star, they were blah, 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 I can tell you, I already know about a handful of people who got accepted because of that. So through your US clinical experience, it feels to me that might be one of the most significant factors. I don't know, how does everyone else feel?
Yeah, if you allow me to jump in here,
yes.
Thanks for summarizing that. It's extremely important. And I would add to that, the students ممكن ياخدوها فرصة إنه to secure a research position during the elective. Yeah. I think whoever interested in surgery, if they work on that, there is a high chance that they may come back and do a research with the same group where they did the elective. If it is not paid position, it can be a volunteer position. So it's doable. It's very important. If you can go to do elective in an academic setting where there is research, that's a big plus. And we're talking about surgery now, but also with other fields. Like I know people who did research 2 years in medical specialties and end up matching in a great programs. And now they match into fellowship because they did the 2 years of research and they're successful. So it adds up. It's not a waste of time or waste of money. That I just wanted to mention that.
I can't stress this enough as well. I was on the interview panel for our residency program for this year. And almost all IMGs who interviewed in our program had research or had been in the US doing research. Most people from every single other country do this. We are still like lacking behind, and mentality عنا لا ضيعش وقت شو بدك تروح تعمل. And I also had that mentality. I didn't come wrong. I really strongly encourage people to come and do research as soon as they graduate. You're a fresh grad, بدكم تعملوا امتحاناتكم, you're trying to figure out what to do. Come here, work here, get letters from people here, get introduced to the system, تعودوا على البلد, تعرفوا كيف تحكوا مع الناس. This is how people from other countries زي لبنان, they succeed. This is kind of their ليش هم أنجح منا, I would say, in surgery, is because they know the system.
Definitely, yeah. I share what Ranim said. I thought research, I wanted to do training immediately, no research. But I realized it's important. And looking back, all what we do in surgery or medicine, it came from research. Whatever surgery procedures we do, or if we add a certain technique, it was studied at some point, either clinical or basic science. So it's really important. It adds knowledge, it adds connection during the year, and it helps in the future, like future career. So,
I'm actually,
I do want to, I'm sorry for cutting you off, but this has been itching in my mind the whole time. I'm glad you guys brought that up. I just want to mention one little thing. The expectations for us as medical students coming from the Middle East or the Arab world, coming here, you'll find I was shocked in my intern year of how much medical students do, how much they involved in the patient care, be there 4 a.m, do all the numbers, round with us and all of that. So if any of you guys is considering surgery and got the chance to do an elective, the program director seeing you being that much active, he has no choice but to consider you at least for the interview. Sorry for the interruption.
One more thing. Sorry. just to kind of set, the way that I did it is I just compared myself to the medical students, or when I was a prelim, the American residents, and I was just like, okay, just do double whatever they're doing. Just if they're there at 5, I was there just a little bit earlier. If they're, you know, whenever they leave, I'd leave a little bit later. Just you can't be at the same level as the Americans. You have to just work harder. You just have to put more effort. And my mentality was, I'm just going to do everything I can. If it doesn't work out, it doesn't work out. But I'm not coming back to Jordan unless I do every single thing I can. And just to let you know the point of desperation, during my second year prelim, when I wasn't getting anything towards the end of the year, I went on the ERAS website and I looked up every single program and emailed every single program, just saying, I'm a prelim, this is what I like, these are my scores. Do you have an open position? Even if they didn't have any openings. And I just emailed a couple of 100 programs. Nothing came out of it. But that was the level of desperation and you know, persistence that it took until the last second when they were like, okay, we have an opening for you.
And we'll talk about the prelim dance in a moment. I did want to just kind of highlight this. When you show up for your clinical experience, right, you want to leave the best impression you possibly can. And it is just that. Show up 5 minutes earlier, leave 5 minutes later. See what everyone does and do 10% more so that you are the most vivid thing that they will remember. And that's obviously easier said than done. I do want to touch up on the fact about the quote unquote years wasted. A lot of people think that, oh, you know, we don't want to do research, we want to jump straight into clinical. That is where the surgical field differs from the internal medicine and other specialty fields. Even direct pathways in the US end up having 2 years of research somewhere in them. And no matter what pathway you take, you will end up having some time here or there that you will have to do something with. Whether it's, you know, doing a prelim year twice, or doing a research year or 2 years of research. Programs here in the US, the big ones, the big name ones, will have you at the end of your 3rd year of training go out for 1 to 2 years of research to build up your CV. Someone asked me what my pathway was in the chat. I'm actually saving mine for the next webinar because I have a different one, but it was essentially credit for years served. I got my full board certification. I was an attending surgeon in Qatar, and then I came over and they gave me 3 years of credit for residency. They said, you are a PGY4. So I did 2 years of training. But again, if you look at that, I, in that case, wasted, I'll put in quotations, 2 years. And I still have 50 publications. So you still have the research aspect. So there is no real way around this. It is a must. And it plays a big factor in everything else. I want to talk about the prelim dance, and then we will open it up to questions from the group. So essentially the pathway here, as everyone mentioned, is you show up and you get a prelim position. This was something that personally frightened me when I first started, which is why I went to Qatar. I said, I want to go somewhere, do a year of prelim, not match. I can't deal with that level of anxiety. And then, you know, look for another prelim spot and then another prelim spot. And before you know it, you've done 2 or 3 years and you're still not sure where you stand. It's not true. Reality is, if you get your foot in the door, if you land one prelim spot, very large chance you will eventually land categorically somewhere. I have rarely, if ever, heard of someone who did not eventually get a categorical spot. It's going to be stressful, it's going to be work, but you will find it. So don't let a prelim position deter you. You see over here, I think how everyone who spoke, except for Mohammed Al-Spah, everyone started off prelim, right? And they matched. You matched.
A little bit, Rasul. I personally know a bunch of people who didn't get jobs after prelim. But really? Each and every, yes, even from my program, but each and every one of them has a different story. There is a reason why they didn't get a spot. And a lot of it, if you like kind of listen to people who got spots and do like what Omar was saying, like, you know, show up half an hour earlier than everybody else, do double the work, put your head down, like just echoing what all of you guys have been saying, then you will get a spot. If you don't, then you're prelim. There is a chance you will go back home.
That's fair. I'll say my personal experience is I only know of one person who did not match after getting their foot in through the door.
Yeah.
But yeah.
I mean, it's a gamble.
It happens. It happens.
And
never say never.
You like bet on yourself and on your hard work and, you know, putting your head down, continue to work. You'll get there almost guaranteed. But if they pick up on the way, you have to know signing up, this is a gamble. I mean, you've seen كلياتنا, we almost didn't make it.
Yeah, very true.
Just one thing, I remember when I was a medical student, just to show how the awareness is very different now, like 6 or 7 years after that. It was well known that it's almost impossible to get a surgical residency in the United States. And we've always been told that most probably you will not match, but there is possibility that you will match if you go to the prelim. Now, 5 years from that time, we're talking about like all the way around it, which is most probably you will match, but there is a small chance that you will not match. That's a very different impression compared to back in 2014 or 2015 when I was finishing medical school. So that's very important for the attendants to keep this in mind.
That is true. That is actually very true. It has changed. I do want to reiterate, if you have any questions, please do type them into the chat.
I just want to mention regarding the mentality when we come in. So like Rasul mentioned, the internship year, it can be very stressful, but at the end of the day, you did 1 year of surgery that added experience, knowledge, and money to you as a resident. So, and most of the people ends up doing surgery either in the same program, like we have an example with the colleagues and or other programs. So it's a great experience. It's not, don't look at it as just a 1 year, I'm gonna waste time, I may waste money. No, it's in your CV for forever.
Yeah. And so I'm gonna open this up just a little bit. I'll ask some of my questions. I personally never went through the match procedure. What do you guys think as a medical student you could do to, you know, make your match application look really good? I know I mentioned US clinical experience because I've seen that play out firsthand. But what else do you guys think really would help a medical student who's thinking of surgery kind of set themselves up for success?
Scores.
I can start. I think the hardest part of the application is the letters because it's out of your hands. You can't just stay up all night and get it over with, or put a lot of work and work really hard and get it done. It's up to other people. You can work really hard to make the impression, but I remember a lot of my stress was getting the letter writers to actually have them submitted. So you have to get on that very early because otherwise it gets very stressful when it's out of your hands and your application is done and everything's done and you're just waiting on these letters. That to me was the hardest part.
All right, letters of recommendation. That actually ties in with a question we just received. So we have a question from someone. They already did an elective in a surgical sub, and they have 2 letters of recommendation from the chief of the department and the program director, which I think is top notch. I mean, those are the people you want a letter of recommendation from. You want it from the chiefs, you want it from the PDs, you want it with the people with the most weight that can pull. And the question is, should they start, looking at a second surgery rotation for more letters of recommendation, or should they focus more on their step scores and research?
Steps and research. You have enough letters for your application. You need other things now. So I would say, like they were all saying, you need, a holistic application or something, you check all of the boxes. The boxes you need to check more is focus on getting okay scores. I'm not, you don't need to get like, in Jordan, we're obsessed with scores. You don't need to get like the number one بالعالم. You just need to get okay scores. And then, if you can come to the US and do research here with surgeons preferably, that will be the best thing you can do.
I have a quick comment, Rasul, on موضوع research, which is we had like a lot of questions about this, which is one like clarify for everyone. Research, I think, is becoming a little bit more challenging because of a couple of things. It's a lot of time is non-paid, and a lot of these programs they have a grant, so they cannot give it someone who's non-citizen. So that's kind of one barrier that we have a grant, we have funds, but you are not eligible for that, so we cannot take you or sponsor the visa. The other thing, a lot of these programs, they want you have a background. So you cannot come with zero research background and expect them to teach you from scratch. Mm-hmm. You have to have something. It's a dance. Same thing for prelim. For research, it's more kind of effort you do. The more can you spend time, like if you can teach, like go for courses to learn like SPSS or STATA or something like this. You want to show up and show off with something that's going to make you kind of make you different from other people applying for research. So keep in mind, securing a research spot, it's not impossible. It's also still easier, I think, compared with the residency, but still the spots there are way limited. Number two, a lot of time is non-paid. And the third thing, not everyone have enough time to teach you the basics of research. So you have to have background before you come. A lot of this is personal effort. There's no one will do like spoon feeding for you to teach you what's research about. You have to spend time and start early, and you have something in mind. And I think a lot of universities in Jordan now changing the mentality that you have to have at least one presentation or one publication before you graduate. So take it beyond that. Okay, I did this, I want to expand more. I know we have limited resources, but I was there. لما كنت أنا طالب سنة خامسة, that was in 2008, and I was able to get 12 publications. So it's not impossible. You can do it. If you have the will, you'll find an answer for that.
And to your merit, research isn't something you always do with dedicated time. I always say, you make the time for research. You don't have the time for research. But we actually have a question in the chat. Do you see it, Auni? I'd like to hand this one off to you about, what kind of research is good and what's the difference between clinical and lab research, and to everyone else who's involved up.
So yeah, I think any research experience will be good, but will be come to think translational. It's great research. I love it. I wish I have more time with this because it can consume a lot of time, and you have dedicated time to do that. But doing that research is good enough as a clinical. One question will be how much you can build up connection based on this. Are you working with, with a big institution and you can get connections? I think regardless what kind of research you do, if you can get abstracts and go to meetings and get introduced to people, that's what you need from the research here. It's not the number of publication per se, but I think it's building up connections and building up with connecting with people. I think that what matters for you at the end of the day with the research here.
Yeah, and I agree. So we see, connections coming into play again. And I'd also like to plug this in. We actually have a surgical research committee as part of our JAS initiative. So we'll be making an accessible place where anyone who's interested in doing research, with a surgical sub in mind, can sign up for. And this will be directly plugged back into the JAPA journal. So we'll have some projects going, and people can start even, in med school, getting a paper under their name, showing that they have that kind of experience, so that when they do want to come to the US to do a dedicated research position, they have something on paper already. So that we will actually be advertising really soon. And in fact, next week, we have our How to Write a Manuscript for Surgeons talk by Dr. Zaid Abdel-Sattar. So do come to that, and we'll kind of show you how we also plan to get you plugged in that sense. So that's that. And then we actually have another question. Did I miss something? Sorry. All right. Next question. For PGY 1 prelim, how to match into categorical the next year? That's a little open-ended. One of the most important things, and I haven't done this, but I've seen some of my interns and other folks do this, and we kind of plug them in. And some of the people here have also talked to, but there's a website called the APDS. So you can reapply for the match, and then you look at this website called APDS, and you could even look at it right now in looking for people advertising prelim spots, first-year resident spots. And they will tell you, oh, we're looking for this position, that position, and you can apply through that. Other things are your AppSite score, research, letters of recommendation, and I'll open up to everyone else if they have any other things they'd like to say.
And yeah, I actually replied in the chat, but I just want to.
Oh, that's you? Okay.
I just want to reiterate one point is that probably if you look at every prelim that matched, I would almost bet that most match at the program they're doing the prelim in rather than outside, just because they know you and you can. That's in your hands. It's a year-long interview.
Mm-hmm.
So that's really, in my opinion, by far the most likely place. So if like Rasul said, once you get your foot in the door, khalas, you're in. But you have to just really work hard because that's going to be the place that's most likely going to give you a spot.
Yeah, I want to stress out the AppSite was mentioned before. You should start preparing for it once you're done with the USMLE. It's very important. If you end up not matching in your program, most likely you're going to match on one of the other programs, and they will look at the score. So it's extremely important. The other thing is the relation. علاقتك مع الchief residents في البرنامج وعلاقتك مع كل attendings. This will matter. يعني if they like you, if they think you're a hard worker, if they think you have basic skills to add on, they will keep you, or they will find somewhere else where there is opening. They will help you to get in. So it's a upside, hard work and dedication.
And to piggyback off of that, this is somewhat of a paradigm shift when you come to the States. In the States, people will actively help you. People like to help. And one very common thing I got from one of my program directors was, we own you for the year, you own us for the rest of your life. And that's the mentality they have, where they will, ride you for the year, but then at the end of it, you own them. So you can call them with any favor you want. You call and you say, I need this. Okay, let me talk to people, we'll get you settled. I want that, or I need that. And that's kind of how the relationship goes. You build the connections, you give them your all, and then they will actively advocate for you. So these US clinical experiences, that's just the beginning of it. And it really is that whole 360 package that comes together where you have, somebody who knows you, you have a good letter of recommendation, you have some research here, you have activities and society memberships, right? You volunteer on the weekends at the Home of Love in Jordan, or you do something where it shows that you are a unique individual who cares. And that all comes together. We have another question. Are there any specific networking opportunities or events that IMGs can participate in to connect with program directors or other professionals in the field? I don't know of specific events. The one that comes to mind is it's part of the American College of Surgeons. And I'm going to butcher this. Someone, if they remember what it is, let me know. But it's essentially the ASE, American Surgical Education, I think maybe. Can someone Google that? I'm pretty sure that's what it's called.
Yeah, I think Dr. Osama Hamid, I think he's since he's the governor, I think he's involved in that program. But still, I don't think we have robust, I will say, connections that we have these events that on our level that we can do. We have kind of a lot of people in the U.S., but kind of having a connection, this is one of the things that JAS is trying to target, is to build up a database for connection with people in the U.S. to help with research and help with the project and also help with connection. But yeah, we don't have, I'm not aware of anything that we have to boost the connections at this current level. But yeah, hopefully JAS will have something in the future, something that can help with that.
Yeah, I've been trying my best to avoid shamelessly plugging us, but you're absolutely correct. We actually do have a networking committee, and one of the projects they're working on currently is we are looking to get a running roster of mentors, surgeons in the U.S., all the medical students and residents in Jordan to help connect everyone together and hopefully have events down the line for the sole purpose of networking. Currently, Facebook will provide that platform. But specifically, I did just look up. It's called the Association for Surgical Education. And they essentially meet. I don't think it would be your best bet at networking. Your best bet probably at this stage would be US clinical experience. But hopefully through JAS, we will provide a platform, for you to come along, get involved in our research projects, meet people, come to these meetings, and this will kind of be the best that we can provide at this junction. Let me see, I think there's more questions.
Yeah, Ranim or Omar, I think they answered some of these questions already in the chat.
How does the year of graduation impact?
This question is better for most of you guys and not me.
Yeah, a little bit different. Okay, Dr. Chris, I see your question. So I actually graduated in 2011, and I applied for a bariatric surgery fellowship at BI Harvard in Boston in 2018. So I was about 6 years out. That being said, the match rate for IMGs into bariatrics, I think, is 0.01%, so it's not the best. Other fellowships do have a better match rate, specifically being HPB and surgical critical care. It is unfortunate, and yeah, not even HPB, sorry, transplant, not HPB. Transplant and surgical critical care, those would be your best options. I see here you did apply, and just because it didn't work, I wouldn't say that's the end of it. Sometimes what you really need to do is after the match cycle has ended, look for those unfulfilled spots, especially in transplant and even surgical critical care. The surgical critical care website, I think, is SCPDS, and you will usually find about 4 or 5 postings of jobs that have gone unfilled. I would think those are probably your best chances if you want to go straight into the fellowship route. And graduation should not be an issue.
Yeah, sorry.
No, go for it, Renee. Yeah.
Also, burn fellowships that usually go unmatched. There's non-ACGME fellowships. There's non-ACGME colorectal, non-ACGME transplant, maybe cardiac as well. هدول معظمهم are like surgeons like yourself خلصوا elsewhere and they want to try to come into the system. You just need to come to the US, and then when people see you, بتتعرف على program directors, تتعرف على ناس, you kind of will figure it out. You just need to come here one way or another.
Yeah.
Keman, it would be very difficult for you as someone who's been practicing, you're practically an attending now, to say, come and do a year of research. But honestly, if you really want to come here, that could be also one of the pathways.
Yeah, I agree. And we actually, sorry, I'll finish this, then you can go, Mustafa. So our next talk is going to be on credit for years served, which is an option. And then the following lecture is actually specifically on fellowships, the route through fellowships. So we actually have almost an entire session dedicated to this, because that pathway in and of itself is actually very complex and involved. And please go ahead, Mustafa.
Yeah, just for the surgical critical care fellowship positions. So the positions in the States are higher than the number of applicants in the States. So last year, I think 85 positions were left behind, like blank. And all of them must go to the IMGs because all AMGs just matched. So it's your best bet, I would say. And from surgical critical care, you can either go back. It depends, but if you want to do it, I think the surgical critical care is the most recommended pathway.
Yeah. And we'll talk, like I said, we'll talk about this more, but after you do your fellowship, you have a number of pathways. You can either go back and redo residency from internship. I know someone who did that. You can jump from fellowship into an advanced chief position. I did that. Abu Talqa did that. We have a few people from Jordan. Actually, I think Jordan maybe has the most amount of people who've done that pathway. I can think of 4 off the top of my head. Or you could even from surgical critical care go straight into an attending position. I also know someone who's done that. And interestingly enough, all of these different pathways, almost everyone from Jordan has done. So
one comment, مسؤول عشان موضوع السيرجيكال critical care, the position is much higher, but just to clarify, Mustafa, because I finished my training, it's ACGME certified fellowship. So a lot of programs, they don't take IMGs and they go unfilled because of specific reason, because they look at the board success rate. So if you have a spot fellowship with 2 spots, and you take one, 2 people, one is an IMG and the other one is like a American grad, and they did all the training in the US. The guy who came from overseas, he's not eligible to apply for the board. So a lot of people don't fill it because this is in the paper will show I have 50% success rate, while I have actually 1 person only who's eligible for that. So I know some programs, they stay away from that, but I agree with Raneem. The critical care / burns, they are non-ECGME certified, so you can get in these. A trauma year per se, it's by itself, the non-ECGME certified. I shared the link in the chat group. It's like for East organization, which is for trauma, and there's a huge list of fellowships, and they have different combination of flavors. So look at them. And as everyone said, don't give up, send emails as much as you can, and you'll find an answer. I know a couple of people who's doing burn / critical care that may open sometime reconstructive fellowships. It's not ECGME, but still you get 2 years of training, and you never know what happened after that.
Yeah, and I only touched on a very important thing, which is all programs in the US are evaluated based on 3 metrics. Surgical programs are based on 3 metrics, and this is the thing the PD cares about, and only the only thing he cares about, which is he or she, which is number 1, what is the board pass rate? What is the result of the resident evaluation of the program? It's a little survey they have us do every year. And number 3, did they meet their minimum case logs? That is the only thing a program director cares about. And the most important one in there is what is their pass rate. The app site is a predictor, a very strong predictor of the pass rate. So you have to score above 30th percentile, means you have a almost 99% chance of passing. That's why the app site is important, and why everyone really cares about the app site result, and why if you ever do get into, AUB, Hamad, or Qatar, where we are ACGME accredited, and you will take the app site, you want to make sure you get that high number, because then you can show the program like, hey, look, I have, the necessary knowledge to improve your pass rate. And I will tell you right now, I think he already left, but Ahmed Abu Amr, that was his biggest help. It was also my biggest help. Number 2, case logs. If you do an ACGME program, you have the same case log system. So when I applied here, I showed up, I was like, hey, I've already got the 1,500 operations you want from me. So those 2 are very, very important fundamental issues. And then the very last part is they want to know that you'll be, making their life comfortable, you're teachable, and that's where your letter of recommendation comes in. So that's really where all of those kind of meet full force. And yeah, I don't know. So the fellowships we mentioned, some are ACGME, some are not. Honestly, I think if you're coming to the States as a first step, whether it's accredited, non-accredited, prelim, categorical, research, you just need to get your foot in through the door. And then you can do your best to market and sell yourself to them, show them what a good and hard worker you are and why you deserve their time and investment in you. Do we have any further questions?
I'm gonna do a shameless plug for my mom who's watching, apparently. Hi, Mama. My sister's like,
Hello. All right, I will like to open up to two actual final questions. So the first one, also open group, is what did you guys think of your pathway overall? What did you like about it? What did you not like? What would you improve? And I'll kind of, we can run through everyone again, pros, cons, room for improvement. Raneem?
I think the thing that I didn't know about my pathway is I would still do it all over again, but I didn't know how difficult it would be. Everyone who's been through the prelim dance, as you're calling it knows exactly what I'm talking about. I mean, just moving to a different country and having just a 1-year contract, not knowing where you're going to be next year, applying to the match 2 months into the beginning of your residency, asking people who just met you to write you new letters of recommendation, paying for the match again. It's just a lot to take in. So you really have to want to do it. I would do it all over again 100 times, but it's just mentally prepare that this is going to be tough. So you really, really, really should not want to do anything else.
Yeah. Yeah, you have to have conviction what you're about to do. Is there anything that you would have, with, hindsight being 2020, done to improve your chances? I know you obviously everything worked out, but anything you think that if you had done, maybe would have made your life a little bit easier?
Yeah, if I spent the 2 years after graduation working here in research instead of working with Jordan, then I would have been a much better candidate. Maybe I would have gotten a categorical min awalha. I mean, the IMG categoricals, as you see, they have done research here. I mean, it's not you. People don't take you as a categorical if you haven't been in this country.
Fair. Yep. Next is Dr. Murar. Same thing to you. Pros, cons, room for improvement.
It's not really fully relevant, but if I'm being honest, my biggest regret is not trying to get into med school in the States and kind of giving up on that idea so I wouldn't be an IMG. But once I was an IMG, the first mistake I made was in my PGY1 prelim. Med school in Ireland was not even close to as serious as it is in the States. And I just didn't take it as seriously as I should have. And I was a little arrogant because I got a 97 percentile on the AB site and outscored all the other prelims. And I was like, that's it. They're going to take me. I got arrogant and I didn't really fully understand the system. I didn't understand how hard they work, how much sacrifice is involved. And that's why I didn't match as a PGY1. PGY2, I did it differently. And it worked out. But again, like Raneem said, it's very stressful. I mean, I got my offer March 27th, by June, I would have had to leave if I didn't get anything. So it was really just a couple of months. I mean, looking for a ticket wasn't that far, away. But other than everything that you guys talked about, the research and all that, once you do get your foot in the door, just mentally just go into a military mode. It's game time and just there's no playing and you really need to take it seriously. You can't, something like playing on your phone, something simple like that looks very bad. If they're talking about a case or I remember my first year of prelim, I still remember this feeling. It was a trauma patient, we were in CT scan and I was looking at something on my phone or something, or playing a game on my phone, and my chief just ripped me apart. And he's like, dude, we're in this CAT scan, we're looking for injuries, and you're just looking at your phone. But that's kind of the mentality I was at. I was still a student in my head. I wasn't a surgeon in my head. And you kind of have to go into that rule. Don't look at your phone. Don't do this. You're only there to be serious. You're not there to play. You're not there to make friends. That would be my biggest advice.
But also please make friends. especially with the nurses.
Yes. Oh, but yeah, of course, the nurses.
Well,
And
the
yes,
nurses,
They can make or break your career, really.
they will.
by the way,
100%
particularly Middle Eastern
make or break
people,
your
some of the
career.
Middle Eastern people in my residency, residents that come that are early and students, they're very good at hissing up to the attendings, and then they kind of treat the juniors and the nurses like crap, and then it all comes back to us.
Yeah, it all does. A lot of people, a lot of program directors will quite literally listen to what the nurses tell them. If the nurses tell them, oh yeah, he seems like a good guy, he's a hard worker, blah, 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 that will be the deciding factor for you. I have seen numerous times where the nurses have said, oh, he's rude, condescending, arrogant, and that was it. There was nothing that person could do to backtrack from that. So it is imperative you treat the nurses very well.
And by the way,
that goes
sometimes they're wrong. Sometimes they're wrong.
Oh yeah. Even
And sometimes they're rude, and you're right, and they're wrong. And even then, you need to you need no pride. Khalas.
Just say you're sorry.
Exactly. Don't argue. Don't.
Now, as a chief, nurses come to me and complain about prelims all the time. And it's like if the categorical does the same thing, they wouldn't complain. It's just people زيهم, they're not going to complain. متعودين عليهم. We really, it's like a social thing. And I'm sorry to all of you guys, but it's most common in Middle Eastern men. You guys all made it, so you guys don't have that trait. But somehow Middle Eastern men, they just don't vibe well with the nurses. If the nurse about you once or twice, you're done.
That's actually very true.
والتوجيهي والامتحانات كله, it's all gone because you didn't tell the nurse, please do this for me.
Yeah, that's actually very true. And that impression, by the way, is actually pretty strong. So a lot of things that I've heard even not directed at me, but directed at other people is, he probably just has a culture clash, being a Middle Eastern male. He doesn't know how to say this. And it's racist to some extent where they say that, because, it's not like we're criticizing ourselves. It's them from another race criticizing us based on race. But that is what happens. A little bit
of a sexist culture.
Exactly. So that is actually very true. So a very big part of your clinical experience when you come of, a prelim year, when you spend it, of everything, is you will want to make sure you deal with everyone delicately. There is no room for the pride, as in, I am the doctor, you are the nurse, and this is what goes and what says and blah, blah, blah. I mean, one story I tell everywhere when I go is, when I was an intern, the charge nurse taught me everything I knew. So who am I not to listen to? Or I look and be like, you have 20 plus years of experience in this field. I am but, 15 years into it. And, if you think this is a good idea, then you tell me what you think. And always, come up to them. What do you think of our patients, right? We use the word our to show them that, they're on the same level as us, providing just as important care. And we talk with them because they also have ownership. So when you come here, it will be very important to be able to play that role and be nice to people. And that's where your personality comes in. And it plays a big role in you being accepted or not. Moving on to Dr. Sbeh.
One thing I would have done it different, يعني بالنسبة لل H1 visa أنا دخلت residency على J1 لأني ما كنت مقدم step 3. I was busy بالresearch year. I left it until after the match. The program which I matched in can sponsor H1. If I have done that route, I would have got the green card during the residency. Well, this may open more opportunities for the jobs and for the fellowship earlier. So this is something I don't regret it. There is always something meant to happen, but something I would have done it differently. I would بعمل step 3 as early as possible عشان when you match إذا البروجرام بيعطي H1 go for H1. You get your green card earlier. It prevents you from going into a waiver job in underserved area because that's a requirement to get rid of the J1 visa. So this is one thing I would have done it different. And regarding what other colleagues mentioned, respect everyone. عامل الناس زي ما بدهم تحب يعاملوك. النيرسز، البي ايز، احنا بالميدل ايست ما عندنا physician assistants. لما نبلش residency في يكون physician assistant, you have to treat them very well. You have to respect them, be nice to them. They have a stronger relation with the attendings and the program director and the nurses, so they can easily kick you out of the program, or at least you won't be ranked for the next year if you have a bad relation. بدك تتحمل, even if you're right and they're wrong, try to be patient. بس اصبر, تحمل يعني for the goal. Be nice, treat everyone well, be professional, وتمشي الامور. Lastly, كل الجراحين هون بحبوا يساعدوا الطلاب. احنا we're looking forward نساعد. وما في شيء بس personally make me more happy اني اسمع another successful story with match or going to research. بس بدنا somebody who is really have a good CV, عنده intention, عنده motive, you know, that will make people help him. But no one will help someone who's not a good candidate, and no one will help someone who really doesn't know. And we may try, but most of the time we fail, because any residency program, there is a committee. The committee choose. They won't listen to any surgeon individually if that candidate is not strong enough to get in. So it is you. It's the applicant job to build himself and build a good CV to get in.
Yeah.
We'll have plan B and plan C. Have plan B and plan C just in case. You never know. Work hard for plan A, but have plan B and C.
Yeah. And to add to that, there's a number of times we get messages like, can you please have a word or help me with this or help me get an interview in that? Unfortunately, it's a little bit different here in the US. Unlike ممكن بالأردن وين في فيتامين واو أو كتير, in the US, the way that we can help if we don't know you personally firsthand is we can pass along your CV. Right? We can talk to someone, be like, hey, I have this candidate, had a look at his CV, it looks good, here you go. And then they make the full assessment. We can't get more involved in that. And that's a big reason why with the formation of JAS, we're looking forward to being able to get to know people more one-on-one so that we can reach out, we can help. We want to see a second generation of US trained surgeons, because I personally, I'm going to get old real soon, and I want someone to operate on me with the same level of skill that I have when I operate on people. So it's also purely selfish, because I'm going to need surgery real soon. I'm going to need a good orthopedic or neurosurgeon. I'm sure of it for my neck and hands, but that's a big part of it. I want to address two questions I see here real fast. What's the best thing to do with your intern year? Absolutely what Raneem said. Do your steps. Work on some research on the side, come join the JAS surgical team, research team, and we'll do a year of research. We'll do like a project or two of research. That way you can get all of that taken care of. Can you match directly from 6-year into a prelim or categorical? Even in the world of internal medicine, I've heard of some people doing that, where it's been like exceedingly difficult and rare. I would say in surgery, you might be able to. I don't know if I know anyone who's done it. You might be able to. I would not recommend it. I would think the more appropriate way is do a year or two, research something, and then move on. Because even if you manage to match, there are some things which may come back to bite you. And I'm not going to go into those details because I think that would maybe discourage some folks. Let's see. I see over here, recommend secure research. Okay, how could we, okay, do we? Oh yeah, so Lan, when, I think some people already answered this, but essentially come over on your US clinical experience, and people here are very approachable. You tell the PD, as I think Raneem is kind of pointing at, you know, who are the faculty that are into research, who has a lab, who has postdocs working with them, who has, a sim center under their name that they're working with. And then through that, you make the connections, you tell them. They might even have you write a small case report to kind of like tease the water and see how well you can write. Before I move on to the next questions, I do want to just call on Dr. Anan Tawil. He is one of our other committee chairs. I think he had something he wanted to say. Anan, are you there?
السلام عليكم كيف الجميع؟
عليكم السلام.
It's good to see some familiar faces here. محمد كيف حالك؟
تمام شكرا عنان تحياتي.
الله يسعدك. الله يعافيك. I just want to mention a few things. Great talk. I got lucky that I was on the committee for interviews. I was with Mohammed Sabeh. I was a year ahead of him, but I interviewed when I was a fourth year, fifth year, and throughout my fellowship. And I can tell you, as a chief resident, if you're a prelim resident, it's very important you keep these things in mind. Number one, it's easier to notice the bad things, and it's very hard to notice the good things. You do one bad thing, it'll stick with you. And this could be as simple as playing on your cell phone, like someone said, when you're taking care of a patient. So if you keep that in mind, that I should always behave, not to scare you, but in residency, walls really have ears. So you really have to be focused on what you do, because people will notice the good stuff after a while, but they'll immediately notice any bad things. Number two, just like Raneem said, it's a completely different culture. And unfortunately, it doesn't work here. The one important thing to keep in mind is you'll always have issues, there'll always be problems. Don't take it personal. And number two, you should always focus on how can I solve it? Your answer should always, an approach should be, okay, there's a problem. How can I fix it, or how can I make it better? They don't like arguments, they like solutions. And they will notice that, and this will take you to places and will make you very successful. And if you're prelim, it's just you have to put in 110%. This is the way it is, unfortunately. And number three, it is really important to ask for help. One of the things that we, as people who interviewed, would always exclude people or just cross them out is if we think they are MacGyvers or if they are not safe. If you're not sure, ask.
Cowboys.
And your chief residents, your fourth years, even your co-interns and your second years or PAs, physician assistants and nurses, they will help you. If you're not sure, you can ask. The ICU nurses have been doing it for 20 years. You just started this month. It's always safer to ask, you know what? I think this is not working. Do you think I should call someone? What do you think I should do? They will help. They will help. It's all how you approach it. Those are three advices I can tell you, because when I was interviewing, or not interviewing, when I was trying to decide who to keep from the prelims, those are the things I was looking for in those residents is, are they having good behavior or bad behavior? Are they always trying to solve problems, or are they trying to argue and make problems bigger? Or number three is, do they ask for help? Are they safe? Or are they just, someone who's out there trying to be the macho or whatever.
Yeah,
and
trying to be a
just
cowboy.
two cents I really wanted to drop there, because I did it for 4 years back to back, and it's always the same constant to look at, these three things.
Yeah, I agree. And actually, to add to that, that is good surgical advice. That is all about what the US is based on. And it's called being a safe surgeon. They want a safe surgeon. And it doesn't just go for interns and prelim, although it's very important for the trainees. I think it was even just 2 months ago, a recent grad had applied for a job. And I had the chief of surgery at where he was applying reach out and said, even the simplest form was like, if this is if this surgeon were to get a case in the middle of the night and got stuck, or a bad gallbladder and, was having issues, would they be safe and call for help? And I said yes. And that was the ultimate deciding factor. They did not want to know more. They did not care about more. They wanted to know that they were, again, reliable, right? So we keep going back and cycling back to the most important things. And these are the things that you need to demonstrate during your US clinical experience, right? When you show up for 1 to 2 months of rotation. And this is what we're kind of getting at. Go for it.
One more thing, Rasul, if you allow me, Anan triggered this point. Leave a good reputation behind you. Be a good resident, لأنه هذه will help other Jordanians to get in. I met Anan during the interview time, and I didn't know him من زمان. So he was a good first year. So they took a Jordanian after him, and وبعد ما إحنا تخرجنا, they took another Jordanian, categorical. Same in St. Agnes Hospital, same in Johns Hopkins. So just leave your good reputation, so you will help others. I think it's important. Don't be selfish. And it helps you. Even in job changes, move from one job to another. Leave on good terms. Leave a good history behind you.
And he's absolutely correct. My program here in Pittsburgh, we've been able to leave a good track record. I know there's a program up in Minnesota, same thing. Hopkins, I know there's like 3 of you right there now, kind of one after the other. So that is very real. You leave a good track record. They start building that level of experience and trust. And that's what we need to get through this, for them to be able to start saying, خريجين الأردنية والله بس مو أحسن من تعاون التكنو. Something like that, along those lines.
Just to stress on that.
You started it. You started it for me. I had to say that.
Yeah. Just to stress on that.
Yeah, go for it, Musa. You have something you want to say?
Yeah. On the other hand, the program I'm starting shortly with has not taken like people from the Middle East for 7 years, because one of the prelims 7 years ago had problems dealing with the female co-intern. One person, and that's why they had me interview literally like 5 or 6 people before, making sure that I'm not the same kind of person. So it's imperative to leave a good reputation, even if you don't match and you don't like them. People will apply after you, and you have to be like to keep this in mind and not be selfish, because you have to leave a good reputation.
True.
Our program is not taking people from a specific Arab country, مش الأردن, for 10 years because of the president who was very, publicly sexist towards his female co-residents.
Yeah, we see that. It's an unfortunate truth, and we do get lumped all together, which is also an unfortunate truth. I did not do a great job as moderator. I kind of derailed this for a moment. Next, we have Auni. Auni, pros, cons, anything you'd like to, if you were to redo with hindsight being 2020, do a little different.
So I think I wish like we had a better kind of exposure to this during medical school, getting exposed to being actual in a surgical rotation, like being on call and all that stuff. I think we're way behind with this. And I, like a lot of people talk to me, I was like, surgery is not easy. So if I can do it again, I wish I love my practice. I love surgery. But I think for people who's coming up to this field, and I know kind of with limited resources and all of that stuff, our exposure to know what's a true surgery about, it's way behind what it is. Surgery is demanding. It takes a lot from your time, from your efforts, from your brain, and a lot of stress. Okay, I want to prepare for this case. So it's not like just being on call. I'm going to put the chest tube, I'm going to take gallbladder, and that's it. It's not. I wish it is like that. It's way more than that. So I wish if we had in our medical school, which is hopefully in the future we change that culture, that we get an actual exposure for what surgery is about. It's not everyone can get the elective rotation. This is how you get exposed to really what's surgical rotation in the US. So this one thing's if we able to change or had the exposure to this, I think that will prepare you mentally better way to apply for this. But my pathway, I don't regret which is a lot of people ask me, do you regret dropping off the 3rd year of general surgery at Jordan coming here? I will say no, I don't regret that. And I think that's a good timing because I was maybe if I stayed for another year, I will get a board and a Jordanian board or Arab board. But I think at the same time, 2 years and not being satisfied with my training was okay, it's time to change, and why not knock that door? So I don't regret that these 3 years. They're not truly wasted. I think I learned a lot, and that made me a better surgeon, more knowledgeable stuff and helping many aspects.
Yeah. And I'm actually going to piggyback on that as soon as we hear from Mustafa and Abu Amr, who also kind of transferred after training. Mustafa, Ahmed, Abu Amr, I am going to lump you guys kind of together just for the sake of time. But, what did you guys like? What did you guys hate? What would you improve?
Yeah, I would say the previous experience is double-faced sword. It can be a big positive for you, and at the same time, it can be a big negative. It depends on how you tackle the challenges that you face. I want to just echo everything that people had mentioned before about being humble, being teachable, and all of this stuff. So that was a big challenge for me. The other thing, the visa. That's a challenge for everyone. A good thing, will I do it again? I think it's probably the hardest way to get to the American board. Well, if you have a different way, a direct pathway would be, I think, the best. But I would not regret anything. Yeah.
I agree with you with what you said, that the previous experience is a double sword kind of thing. And sometimes I'm living the junior life again, doing all this again. I have some regrets, but I know if I didn't do this, I would have a lot more regrets. One little thing I want to touch base on is, I know at prelim, you have to be like, the star of the whole class to be like picked and all of that. Sometimes my PD would come to me when I was a prelim and force me to go home, because I was like, I was trying to show I had no like other plans. That's it. So being friends with everyone, nurses, techs, radiology, following up on the pathology, and you have to be like one step ahead of everyone else in order to stand out. Yeah. I've seen a lot of people doing it. Even people, as I said, everyone has a different experience. But if you really want this and you put the work to it, it will eventually work. And I'm more than happy to answer people like on emails and stuff they need help with.
Yeah, no, I agree. I also did the whole training before and training after. And I have to admit, for me personally, you all mentioned double-edged sword. That's absolutely correct. You have to leave your ego at the door and come in and say, I'm here to learn. I'm here. I'm a blank canvas for you to work with. I will say for me personally, I thought it actually significantly enhanced my education, because I would show up already knowing, how the procedure is done, indications, blah, blah, blah. And now I could really get into the nitty-gritty of the surgical procedure. Why do I decide to cut here and not here? Why am I applying this level of tension and not that one? It helped, in my personal opinion, elevate my training. So I actually enjoyed that pathway. And I'm also one of those people where if you tell me research 3 times, I just drop that. It stresses me out so much, although I love to do it also. So that's all great. So just kind of in a quick recap, we've kind of touched on what we thought was the best way to start prepping as a medical student. We've mentioned U.S. clinical experience, how vital it is to show up, leave a good impression. We've highlighted some of the main ways about which you go about making a good impression, showing up 110%, etc. Your research resume, getting that started, then rolling, we can start helping with that. The networking aspect will also all work on together. And then, you really do have the options of showing up for research and then applying for the prelim categorical kind of transition. I hope everyone who attended today, we maybe gave them a little bit of more hope, some clarity on the options they have, and, don't frown upon the research 1 or 2 years they have to do. Even if you match at Harvard, they will literally push you out as a 3rd year to go do 2, 3, even 4 years of research. They will force you to do that. So everyone has to do it. This isn't internal medicine. They push you out in part because they want you older and they want that maturity that comes with age. I mean, that's as blunt as I can put it. So you're not wasting time. Some people will say there shouldn't be a surgeon under 35 years of age. Whatever, they can say that, but there is no time wasted. There really is not. Moving forward, we have a bunch of other lectures about other pathways. The upcoming one will be about credit for years served. You actually can transfer your surgical training overseas in one of 3 different ways. So we'll be talking about that. We'll be talking about the fellowship routes, and we'll even be talking about the route of just coming to the US and practicing. We have about another 5 sessions in line, and I hope you would all join us again, because I do feel knowing all the options, today we touched on 3. There's about 15 probably, would really help you in the decisions moving forward. We will start working with our networking committee to help start establishing the connections between us and all of you. And I saw someone asking about emails for connections, etc. We are actually actively working on this. We also want to build a mentor-mentee kind of program. So I ask you just be a little bit more patient with us. In the meantime, do reach out to us through Facebook. A lot of us are on the Facebook group. We are admins. You can easily find us. If you can't, leave a post. We will respond to it as soon as we can. And I think that is everything. I'll open it up to Omar, who's also our co-chair. Omar, is there anything you'd like to add or any additional thoughts?
I don't think so.
All right, fair enough. Everyone else, any closing remarks?
Thank you.
Thank you all. Before we all leave, I do see someone mentioned, do we need help in organizing committee? I will actually say yes. In the networking committee, we would definitely appreciate the assistance of medical students and residents in Jordan in, being the other side of this for us all to be able to build that networking committee. So do reach out to us via the Facebook group and we'll be able to take next steps forward. And I'll put you guys in contact with the networking committee chair. And that's all. All right. Thank you all.